So a brief summary of today's lesson. So just to reiterate, this tutorial is for educational purposes only. This tutorial is not designed as a diagnostic or to treat anyone or make any recommendations that learners deploy or take any of the content as part of a treatment plan. The tutorial is strictly for educational purposes only. So we touched on depression. So clinical depression and bipolar disorder are examples of mood disorders. The DSM-5 states that in order to be diagnosed with depression, the person must experience a depressed, low mood or loss of interest, pleasure in everyday activities, must be experienced for at least 2 weeks. In addition to this, at least 5 more symptoms must be present nearly every day. These symptoms include lack of sleep, insomnia, too much sleep, hypersomnia, a change in activity levels, loss in energy, fatigue, feelings of guilt or worthlessness, poor concentration levels, slow thinking or indecisiveness, suicidal thoughts or plans, change in weight and or appetite. Manic symptoms of bipolar disorder can include the following: feeling happy, excited, and or better about yourself than normal, even when things are not going well, having lots of exciting ideas, moving quickly from one idea to the other, and being easily distracted, not being able to or wanting to sleep, making big or unusual decisions with little thought, engaging in risk behaviors, for example, spending large amounts of money, having casual sex with different people, gambling, using drugs, and drinking excessive alcohol. So once again, this would be a mental health professional, appropriate mental health professional would diagnose this using the Diagnostic Statistical Manual DSM-5 of mental disorders. It's used by clinicians and psychiatrists to diagnose psychiatric illnesses. The DSM-5 is published by the American Psychiatric Association and covers all categories of mental health disorders for both adults and children. The DSM-5 is more widely used in the United States for psychiatric diagnoses, treatment recommendations, and insurance coverage purposes. So clinicians utilize the Diagnostic and Statistical Manual of Mental Disorders published by the American Psychiatric Association to determine whether a set of symptoms or behaviors meets the criteria for a diagnosis of a psychological disorder. The International Classification of Diseases published by the WHO is also frequently used. The ICD-11 classification of the International Classification of Diseases published by the WHO, and that's more generally used in Europe than the USA.